Thank you for having us here today at the Mater Hospital in Brisbane. I just wanted to begin with what your sense of this year's flu season might look like.
The answer to that is we just don't know. We don't know what a flu season looks like until we're in the middle of it or in fact past it, because there are so many factors that determine what we see. When we look at the data so far this year, it's actually been interesting that we've had quite a high number of cases in the summer months, so high levels of interseasonal flu. And in fact, we're tracking at about 64,000 cases across the country so far this year. And if you look at January, February and March, we're at about 1.5 to 2 times in those months what we saw last year. And last year we had over 360,000 cases, so it was a very big year, bigger than 2019, so bigger than prior to COVID. With those high levels of interseasonal cases, it really should highlight that we need to do more to address the flu, and finding those cases and giving people specific advice on how not to spread it and how to manage it is also a huge part of that. And that's certainly something we need to do more of. I think one of the challenges at the moment is that people underappreciate the risk of the flu. And if we look at admissions, we've seen nearly 1,000 admissions across the country with influenza. Well over 400 in children and nearly 400 in older adults have been admitted with the flu. We obviously want to try and diagnose them quickly. Having a test that we can rely on makes an enormous difference. That's the thing about infectious diseases, is the quicker we know what it is, the quicker we can reduce that risk for everybody else as well. We perhaps have a slightly complicated testing algorithm here for a variety of reasons, but it does include having a PCR that we can access fairly rapidly. There's a number of different ways people might present with the flu and a number of different, opportunities to diagnose them quickly. Obviously the more severe end will come via our emergency departments, of which there are a few. And we obviously want to try and diagnose them quickly, because that's where we can put them on the right path, including getting them on the right therapy, the right supportive management that's required, but also isolating them to protect our other patients and staff. When we look at the fundamental properties of any test, usually there's a trade-off. So speed can sacrifice accuracy, sensitivity or specificity, for example, but having something that can do both, so both be rapid but also highly accurate, obviously makes a tremendous difference. And if a test doesn't perform well, that can cause so many issues with clinicians not trusting that result. I think we've got to educate clinicians a little bit about the tests that are available and how to access them quickly and the importance of doing that, and then consumers or patients about the importance of doing those things as well. Collect the specimens as people come in, ideally as quickly as possible, and then the testing is done in our laboratory. Once it hits the lab, the testing's done very quickly, so we can get those results out rapidly. Basically, every second counts. It looks so simple, but there's amazing technology in there.
One of the key features is the simplicity of the workflow for the test. We're just wondering about, what can be, the downstream cost of not treating urgently.
One of the challenges of trying to work out the cost effectiveness of interventions like this is it's really hard to link those things together firmly and count them, but delays in terms of hospital discharge, so more days in hospital, and that has a huge cost and an impact on our healthcare system as a whole. Functional impacts on that individual patient, lost productivity, if they need assistance with activities of daily living. So the faster we rule in things and can treat people better, but also the faster we can rule out things and not have to do interventions that aren't required, the savings are potentially enormous.